The driver of starting these groups was loneliness and the idea that, we live in a society where everything is individualized. Our care is individualized. We take care of ourselves, but that's not how humans work so much of the time.
There's research that's been shown that loneliness is linked to not just mental illness or mental health conditions, but also other chronic illnesses.
We need community, we need support, we need more than a 10 or 15 minute visit with our doctor every once in a while to really get that care and practice healing and wellness and to really thrive, I think, as human beings. And so much of the time we're just alone and left to do everything by ourselves.
I joined this group to help me lose weight. But what I learned from the group is that it's a lot more than just losing weight. You gotta love yourself. You gotta take care of yourself, put yourself first. So those are the things that kind of helped me understand, okay, so this is what I have to do to feel good about myself, and then I can lose the weight.
I was going through a very, very bad phase where I was in a lot of pain.
I am here because I want to manage my diet.
I always had an unhealthy relationship with food, and I have physical problems, so I thought this would be a good way to, maybe hear other people's stories, what they were going through, and just learn more about what I could do for my own situation.
One of the things that has helped me a lot is being able to ask a question in the group.
You come in, you can ask questions. We have the doctor and we have our nutritionist, both of them are here. So yeah, you get to ask these questions and they answer it to the best that they can, and it's really cool.
And the different topics are really good. And I also really like the incorporating the yoga.
We're able to make changes in our life, positive changes that we want to make when we feel seen and heard, and when we can see our experiences reflected in other people. That's something that's best done in community.
Having a community of people here that are going through similar things and we all get together and just talk, it's just really good. It feels good to do that.
For me, it was like therapy. There was a way for me to get support.
Just to talk with other people and not be judged, and it feels like a safe place for me. So it's like a shot in the arm every week. I really appreciate having this.
This is a way that we can transform healthcare to be not so individualized and really provide support, whether it's medical support from providers, but also just community support from each other and sharing stories with each other.
What are some common traits or issues or complaints that most patients or participants have during the COVID relief?
So when we first began the group, Pimba and Miss Jones, they actually were doing great. We ended up forming a friendship, essentially. And the purpose of the group was just to provide a safe and open space to speak about, again, everything that's going on in the world right now, or anything else that they would like to share, and just to connect with one another and have that support.
Right, and I would also add that the initial focus was about anxiety around COVID-19. But if you have anxiety around COVID-19, it's not just COVID-19, because it doesn't exist in a vacuum. It's all the other factors, the media, the behaviors of government officials related to the virus, related to protections from the virus. None of this happens in a vacuum. So it's really just a safe space to talk about everything that's going on.
What type of connection are you guys making in this group, if I may ask?
Supportive, women power, supportive, can have different views but still be respected. That's not normal nowadays.
I would also add that it's a room full of equals. Nobody's trying to be the star. Nobody's trying to dominate. We're all just sharing where we are at the present time.
I feel a sense of connection, and I don't always.
It's just very relieving to come and join this group and speak with the ladies for an hour and just to connect and get that support, because I feel like these past few months, we all had to undergo a lot of changes. So this is just a phase for me as well, although I'm doing my job.
Thank you so much for sharing. If you guys have any last thoughts of what you want to say.
Working at Heartland has been one of the most amazing professional experiences that I've had, because everybody there is there intentionally. They're not there to further their own agenda. They're there to serve the community. Please give to Heartland. It's amazing.
I am very grateful for Heartland and the connections they have.
I say support Heartland and give deeply.